I'm really, really proud to be here alongside all of you and alongside the other great speakers on this platform. And how fantastic that at a march that's led by mums, women from Darlington, and we've got an all-women platform here, and 80%, so let's hear it for the 80% of NHS workers who are women. And I'm really proud and humbled to be here, and it's fantastic to see the coalition of people who've come together to support this march and to support our National Health Service. So a thank you to the Nottingham City Council, who've been fantastic in supporting it, to all the trade unions who've joined us along the way, whether it's the GMB or the CWU or Unison. You've been absolutely brilliant. And I wanted to say thank you to all the political parties that have supported it, not just the Labour Party, but we've seen the Green Party here today and other parties who are here. We're united in saying we will stand up for our National Health Service. Earlier, and I met a couple of people who had come over from Staffordshire specifically to join it, and I know there's a group here from the Walsall Pensioners Convention as well, so give them a bit of a cheer. So many of us, I'll come to that. Let me get on with it. Right, you know that the National Health Service cares for us from the cradle to the grave. The first person I saw when I was born was an NHS worker. My children were born at the City Hospital up the road. I was cared for by National Health Service workers. It was the National Health Service that cared for my mum when she was dying of cancer, and the National Health Service that cared for my dad when he was old and needed. And my rely on the NHS day in and day out. So whether it's the people who work in our community services, whether it's the people who work in the mental health services, or whether it's the people who work in our hospitals, we rely on every single one of them every day. But under the Tories, that service is under threat. £3 billion they've wasted on a top-down reorganisation that nobody wanted and nobody voted for, bringing the private sector and competition into every part of our National Health Service, cutting the number of staff, and I would say frontline staff, but our health service doesn't just rely on doctors and nurses, it relies on everybody who makes it work. Now here in Nottingham, I've seen directly the impact that privatisation has had. Jean, who's one of my constituents, has to rely on the privatised patient transfer service. She's 84 years old and she needs dialysis 3 times a week. Now that it's been privatised since 2012, sometimes she's had to wait for hours to get to the hospital and for hours to get home again. Well, Jean deserves better and my constituents deserve better. We deserve better. And last week, I met one of the people who works at the hospital, who works for the new privatised estates and facilities. You might know that in our hospitals, everybody who works providing catering and laundry and cleaning and portering have all been privatised. This woman had worked at Queen's Medical Centre for years. She said for the first time that she'd worked there, she feels like she's a number instead of a person, and she doesn't feel like she's got the time to talk to patients because she's got the private company breathing down her neck. Well, NHS workers deserve better, and we deserve better. Now, the lady down at the front here, she's saying to me, what's Labour Party policy? Well, let me be very clear. The Darlow mums are taking this message down to politicians, but I know, unfortunately, the Tories and the Lib Dems can't be relied upon to listen. But next May, people will have an opportunity to speak and they'll have to listen. The Labour Party have committed to repealing the Health and Social Care Act. We'll take competition out of the National Health Service. We'll deliver a service that's focused on patients, not profits. So just remember that, and let's take that message and let's say it's our NHS and we're taking it back. Thank you.